Thank you so much for joining us for this episode of Leading Change. My name is Emma, and I have Paige with me today, and we're going to be talking about value-based care in the space of healthcare. But before I get to all the questions that I've got for you, Paige, can you give a quick introduction?
Yeah. Emma, thank you first and foremost. Thank you so much for having me on. I love your podcast. I love your content. So I'm excited to be here. So my background is in healthcare and digital transformation specifically. I worked for the largest insurer at one point and have been doing digital transformation implementations for the past few years. So I'm excited to be here. And I'm excited to talk about value-based care and why it's important to me.
Great. Well, I'm excited to have you here as well. So I want to get started with, I always kind of talk about like a foundational question to get us started. So for anybody that might not be familiar with the idea of value-based care, can you give us a quick introduction to what the concept is?
Yeah, absolutely. So in a more textbook sense, value-based care is a shift from a system that rewards volume to, when I say volume, that's more like fee for service. So how many services are being provided, the providers are compensated for, rewarded for. And in value-based care, we switch that to value. So looking at things like patient outcomes now matter, and providers are rewarded based on the value that they bring to their customers, not just the volume of services that may not be getting the patient outcomes that they need.
Well, obviously, this is something that I think most people that are patients, which is all of us in the healthcare system, kind of like the sound of, especially in light of everything that's been going on. But I think what I'd like to then kind of transition to is when we look at the healthcare industry, there's kind of like three groups that come into play. There's obviously the patient, like all of us, there's the provider, and then there are the healthcare payers. So can you talk about how this approach kind of impacts each one of those categories?
Yeah, absolutely. So for providers, this looks like AI documentation and coding. The key goal here is to allow the providers more time to spend with their patients. So using AI for documentation and coding, there's some specific technologies that are working with doctors for that, providing providers with real-time analytics and data to help them make informed decisions, so that they can put together the best treatment plan for their patients. It also looks like predictive analytics for risk stratification and, like I mentioned before, clinical decision for support. So that's really the provider lens of what that looks like and kind of what a provider could expect as the shift to value-based care and being infused with digital transformation. For the patient, this looks like AI being infused for early detection of diseases or different symptoms that are concerning. It also enables virtual and remote monitoring. So this is where kind of IoT and the Internet of Things from digital transformation crosses over into patient-centered value-based care through things like wearables, your Apple Watch, or I think there's a ring out there now. And then for the patient, it also looks like a digital front door being enabled. So a key tenet of digital transformation is allowing the consumer to now choose their preferred method and of communication and interaction with the company. So the digital front door now enables chat, live chat, virtual agent, chat bots, things like email and access to portals, everything kind of on demand so that the patient doesn't have to necessarily call in if they don't want to. But it also ensures that if they do call in, they're getting to the right place faster. So more informed decisions on the patient's end when it comes to their care plan is really essential and part of value-based care. And then on the provider side, this looks like digital transformation, infusing the provider with AI claim adjudication, uh, which, there's been some press about that lately in the news, but I think that we're coming to a different point in AI and digital transformation and starting to be a lot more responsible with that. So AI claim adjudication, real-time data sharing. And so this enables like interoperability between providers and payers.
When we take a look at I've got one of those rings as well and my Apple Watch.
Yeah,
So
okay.
clearly I'm
Yep.
like primed and ready to take advantage
Mhm.
of some of these options. But I would love for you to help us understand maybe some of like specific examples of where you see this value-based care coming into, like, again, specific companies or use
Yep.
cases that you've seen taking place.
Yeah. So it's interesting because back since 2020, 76% of healthcare organizations have accelerated digital transformation. And, that's 5 years ago. So you have, right, the majority of these healthcare organizations, providers, payers, infusing all of their systems with digital transformation solutions. They're really revolutionizing value based care delivery. So examples of companies that are kind of making this happen, literally companies are banding together to make value-based care come to life. So Epic and Cerner, they kind of dominate the electronic health records. Companies like Genesis and Five9, they kind of play in the CCaaS world, and this is where CCaaS intersects with digital transformation, and the digital front doors open for the patient. So they are kind of transforming omni-channel patient engagement. Like I said before, the chatbots, the email. There's various texting platforms as well that can be integrated with these call platforms. A really cool one out there is called Tiger Connect, and this allows providers and patients to text securely. It's HIPAA compliant and high trust compliant. So that's a cool one. Another one that I think of that's kind of been a mainstay in healthcare for a long time, but has really gone through a full transformation themselves to develop their cloud solution is Pega. Pega automates complex workflows and the care management process. So that helps providers and providers and payers coordinate care, manage authorizations, and then start to track those outcomes. Um, let's see, other players probably include like Teladoc and Amwell and telehealth. Telehealth has, skyrocketed since COVID. We already talked about wearables, Fitbit and Apple, and then population health analytics. This is also another important point for rewarding providers based on the value that they're delivering. So those are companies like, Vestier, should probably just match that name, and Health Catalyst is another big one. And then when you look at like the cloud infrastructure, you've got, of course, like Microsoft and AWS. So those are kind of some of the big companies that I see kind of playing and coming together upstream and downstream to enable this value-based care journey for the patient. Let me ask you this, Emma. When you hear the term value and value-based care, what does that mean to you? Because when I first heard value-based care, I was like, it's kind of a heavy word, value. And I see some people putting an S on it.
Yeah, well, I guess when you first brought up the concept and we were talking about this, the value-based would come from like what the patient perceives as value. And
Yeah.
the definition that you provided definitely feels like it kind of like goes in that avenue, because ultimately patients are looking for providers that are going to help them solve their problems and like get to the root cause. And I think part of the struggle that we see within the healthcare industry is a lot of like treating symptoms and quickly trying to move people through, as opposed to digging deep. And so I would hope that the value part of this comes back to that idea of like root cause analysis and helping people actually solve their problems as opposed to just treating symptoms.
Yeah, absolutely. And that's interesting. So I had a kind of personal experience with value-based care when I was on the journey for my son's autism diagnosis. And so that's why that's kind of it's a very important concept to me, because what we experienced was, multiple providers, multiple services, uh, and autism diagnosis come a long way. My son's 7 now, but when he was 2.5, 3, he hadn't missed a milestone yet. So he was high functioning, and then his speech started to decline, and he was regressing and losing different skills. Went to multiple providers, keep doing speech therapy. Speech therapy is not working. Referral to another provider for play therapy. Referral to another provider for an ENT to check hearing and things like that. Suggestion to remove his tonsils and adenoids. It's a very traumatic surgery for a 3-year-old. And then, I was at my wit's end. I had to take a leave of absence from work because my son, his behavior was challenging. And I felt like providers were not giving him the time. And with autism and, many other things that children struggle with, early intervention is so important. And with autism, early intervention can improve outcomes by 66%. So I wanted to make sure that my son got that care because we were in that critical stage there. And what it took was one provider that was willing to spend her time with him. She spent like 2 hours with him. She sent a student of hers to his daycare to observe him. And then she took his case to a conference, because by the time we got to her, he had wrapped up about 8 different diagnoses. And she went through one by one and started ticking them off. And she was like, okay, I'm comfortable. Let's give him an autism diagnosis. So that allowed him then access to get the services that he actually needed. For over a year. He wasn't making progress. So the fee-for-service model, referral doesn't work. So when I think about value, I think about obviously that specific scenario and how I never want anyone to have to go through what we did, or any child to have to go through what Decker did. But I also tend to think about intrinsic values. So how are these companies living up to their values? Like compassion, integrity. Those are really important ones to a lot of healthcare companies. So you've got your values, and then your actions, your principles. Your actions enable your principles, and how is that lived out with these organizations? And I think that value-based care is really our time as a patients to determine, are these companies living up to their principles and the principles of value-based care, which is, patient-centered care, better outcomes, transparency and accountability, things like that. So I think it's a really cool concept.
Well, and I thank you for sharing that personal experience.
Yeah.
Our youngest daughter has a solitary kidney, which is not the same thing. Like, we knew before she was even born that was going to be the case, but we've had a similar experience from the standpoint of a referral to nephrology, and then urology, and then back to other, and like round and round and round and round, and to the point where, again, like as a parent, it was our job to become the care coordinator and making sure that the appointments were taking place when they were supposed to, and that she was getting seen. And I actually had an experience recently where we had been doing what had been recommended. We finally got a referral back to nephrology. And when we were talking to them, they were like, well, why hasn't she been seen? Like, why hasn't she been here since she was a baby? I'm like, I don't know. Like, I've been doing what you guys have told me. Like, and that feeling of like somehow that you've done something wrong and haven't taken the steps to take care of your child is a really frustrating. And thankfully, everything is okay. And we didn't, have any need for additional intervention or something because something was missed. But, that feeling as a parent, or even when it's your own health, trying to like navigate that system and feel like even though all these people have the expertise, that you still have to take ownership of it. I think that's a really good point, that the value comes from these companies actually living up to what their values as organizations are and what the intention behind the industry is. So I really appreciate you sharing that. And I think that that's a really important point to make when we talk about this whole continuum, as and look at this hopeful shift that we're going to make.
Right. Yeah. I also think about value-based care as kind of a call to action. Patients, be engaged in your care. There's a provider satisfaction score now. So think about your CSAT scores or your NPS. Providers now have a PSAT. So take those surveys, make sure that your care plan is meeting your needs. And then I think too, for the vendors that are playing in this space with healthcare companies to enable value-based care, it's it's kind of call to action to them that they have to be a strategic partner and come to the table with customized solutions. Right, out of the box stuff doesn't really work to enable something like this. So they need to work together with these healthcare organizations, and then I think obviously AI. Right, we have to use that responsibly, keep the human in the loop, and it's up to us to humanize AI. So yeah, I'm excited about it, and I think that healthcare has gotten a lot of bad press lately, but there's so much cool stuff going on.
Yeah. Well, thank you for joining me for the conversation and taking the time to share a little bit more about this with us. And for anybody that isn't, make sure you get connected with Paige. And thank you for joining us for the conversation, and have a wonderful day, everyone. Thanks for joining us for this episode of Leading Change. If you like what you saw, be sure to come back on a weekly basis and subscribe for more expert interviews focused on digital transformation, change management, and emerging technologies.